Okay, so welcome back, and today we'll discuss about the cavities of the human body. So different types of body cavities present in the human body we will discuss in this lecture. Number one, the body cavity is divided into two segments. First is the dorsal cavity and next is the ventral cavity. There are two segments of the body cavity, dorsal cavity and ventral cavity. Dorsal cavity again divided into two segments, that is the cranial cavity and vertebral cavity. This is the dorsal or posterior part of the body, cranial cavity and vertebral cavity. In the ventral cavity divided into three portions, that is the thoracic cavity, abdominal cavity and pelvic cavity. So these are the five cavities present in your body and divided into two segments, dorsal cavity and ventral cavity. You can see this is the dorsal body cavity. Dorsal means the back side of the body or posterior part of the body. And this is the ventral body cavity, means anterior of the body parts. You can see this is the anterior and this is the posterior. Posterior is called the dorsal body cavity and anterior is called the ventral body cavities. In the dorsal body cavity divided into cranial cavity and vertebral cavity. In the cranial cavity, the organ is protected, that is brain. And in the vertebral cavity, the organ is protected is the spinal cord. And in the ventral cavity divided into thoracic, abdominal and pelvic cavity. In the thoracic cavity, the organ is protected lungs and heart. You can see this is your lungs and this is your heart. And in the abdominal cavity, the organ protected, that is the small intestine, large intestine, stomach, liver, pancreas and major portion of the large intestine, and rectum portion comes under the pelvic cavity. So next is the pelvic cavity, protect the reproductive organs in the males and females. And by combined or joined together of the abdominal cavity and pelvic cavity combined, we can say abdominopelvic cavity. So this is the thoracic cavity and this is the abdominopelvic cavity. Abdominopelvic cavity means joined together of the abdominal cavity and pelvic cavity. So this is all about the cavities of the human body. Next is the abdominal regions and quadrants. So different types of abdominal regions. There are mainly 9 regions of the abdomen presents. We discuss. You can see this is the 1, 2, 3, 4, 5, 6, 7, 8, 9. You can see here 9 regions of the human abdomen. First is the, you can see here, umbilical regions. Umbilical region means where is your navel present. This is called the umbilical region. Just upper the umbilical region, that is the epigastric region. Epi and gastric. Epi means upper and gastric means stomach. So this is the portion present just above the stomach sides. This is called the epigastric region. Next is the hypochondric region. Hypochondric region again divided into two, right side hypochondric region and for the left hypochondric region. So why it is called hypochondric region? What is the meaning of the hypochondric? So hypochondric is the Greek word which means the cartilage. So here is the sternum cartilage or vertebral, ribs cartilage, that is the costal cartilage. So costal cartilage present in the ribs. That's why it is called the hypochondric region. So hypochondric region, why it is called? Because of the Greek term hypochondric. Hypochondric means the cartilage and cartilage present in the costal cartilage in the ribs. So right side right hypochondric and left side left hypochondric region. Next, this part is called the right lumbar region. So in the lumbar region, in the vertebra, there are different segments like a cervical, thoracic, lumbar and sacral and coccyx. So this is the lumbar region of the vertebra. That's why it is called the right lumbar, and toward the left side, left lumbar region. Next is the iliac region. In the pelvic cavity, there is specific bony parts, that is the ilium. That's why it is called the iliac region. Or in the appendix, this is called the ilium region. That's why it is called the right iliac region and left iliac region. And next is the hypogastric region. Hypogastric means just below the umbilical region. This is called the hypogastric region. So these are the 9 regions or segments of the abdomen. You can see here what are the organs present in the different types of abdominal regions. You can see this is the right hypochondric region. What are the organs present? This is the liver, gallbladder. And in the left side, what are the organ present? Diaphragm, spleen, and stomach. Same, you can see different types of organs in your different types of quadrants in your different types of region. So first is the hypochondric region, liver, gallbladder, right kidney, and small intestine. Epigastric region, stomach, liver, pancreas, duodenum, spleen, adrenal glands. Left hypochondric region, spleen, colon, left kidney, and pancreas. Right lumbar region, gallbladder, liver, and right colon. And umbilical regions, umbilicus means navel, parts of the small intestine and duodenum. And left lumbar region, descending colon. Descending colon is the parts of the large intestine and left kidney. And right iliac region, appendix and cecum. This is the parts of the large intestine. And hypogastric region, urinary bladder, sigmoid colon. This is also the parts of the large intestine and female reproductive organs. And left iliac region, descending colon. This is the parts of the large intestine and sigmoid colon, also the parts of the large intestine. So these are the different abdominal region we use during the general examination of the abdomen, like a palpation, auscultation, percussion. These all are the examination steps of the abdomen. So when you are doing in a hospital duty, then you have to meet the different types of abdominal regions. So this is all about the different types of abdominal regions and quadrants.